Welcome to our detailed guide on respiratory prioritization for the NCLEX Registered Nurse exam. Prioritization is a crucial skill for nurses, especially when it comes to respiratory issues, as these can quickly become life-threatening. In this video, we'll break down the key concepts, provide practical examples, and help you apply common sense to make the best decisions on the exam. Whether you're a new nursing student or preparing for your boards, understanding how to prioritize respiratory problems will give you a strong advantage. Let's start by exploring why respiratory issues are often considered a top priority in nursing care. Respiratory problems are prioritized because airway and breathing are fundamental to life. The ABCs, airway, breathing, circulation, form the backbone of nursing assessment and intervention. If a patient's airway is blocked or their breathing is compromised, it can lead to rapid deterioration. That's why on the NCLEX, questions involving respiratory distress or airway obstruction should catch your attention immediately. Always remember, without oxygen, other interventions become meaningless. This is the core of respiratory prioritization. Let's review the ABCs: airway, breathing, and circulation. These three steps are the foundation of emergency response in nursing care. Airway refers to ensuring the patient's airway is open and clear. Breathing is about making sure the patient is actually moving air in and out of their lungs. Circulation involves the movement of blood throughout the body. On the NCLEX, if you see a scenario where the airway or breathing is threatened, those options should be prioritized over circulation or other concern. Recognizing the signs of respiratory distress is vital for prioritization. Look for symptoms like shortness of breath, use of accessory muscles, cyanosis, confusion, or abnormal breath sounds. On the NCLEX, these clues often indicate a need for immediate intervention. If a patient is struggling to breathe, this takes precedence over issues like pain or even abnormal vital signs, unless those are directly related to breathing. Always use your common sense. If someone can't breathe, nothing else matters. The NCLEX, you'll encounter various scenarios involving respiratory issues. These might include asthma attacks, choking, pneumonia, or COPD exacerbations. Each of these conditions can quickly become critical if not addressed promptly. When reading questions, identify if the scenario involves any threat to the airway or breathing, so those interventions should be your top priority. We'll walk through some specific examples in the next scenes to help you practice this skill. Imagine a patient experiencing an asthma attack. They're wheezing, struggling to speak, and appear anxious. On the NCLEX, your first action should be to ensure their airway is open and administer a fast-acting bronchodilator if available. Don't get distracted by less urgent interventions like documenting or providing education at this moment. The immediate focus must be on restoring effective breathing. This example highlights the importance of prioritizing respiratory interventions above all else. Consider a patient who is choking on food. They're unable to speak, cough, or breathe. In this situation, the airway is completely blocked. The correct action is to perform the Heimlich maneuver immediately. On the NCLEX, always choose the intervention that directly addresses airway obstruction first. This scenario is a classic example of why respiratory issues are always at the top of your priority list. Patient with pneumonia may develop complications like hypoxia or respiratory failure. Watch for signs such as increasing confusion, restlessness, or a drop in oxygen saturation. On the NCLEX, if you see these symptoms, your priority is to support their breathing. This might mean administering oxygen or preparing for more advanced interventions. Don't let other issues distract you from the primary threat to life: impaired breathing. Patients with COPD are at risk for sudden exacerbations, leading to increased shortness of breath and decreased oxygenation. On the NCLEX, if you encounter a COPD patient who is suddenly more breathless or has a change in mental status, prioritize interventions that improve ventilation, such as positioning, administering prescribed inhalers, or providing supplemental oxygen. Always address the most immediate threat to breathing first. Sometimes you'll be asked to prioritize care for several patients at once. Always start by identifying who has the most immediate threat to airway or breathing. For example, a patient with mild pain can wait, but a patient with severe shortness of breath or stridor needs attention right away. Use the ABCs as your guide and apply common sense. Life-threatening respiratory issues always come first. NCLEX often tests your ability to use common sense in prioritization. If you're unsure, ask yourself, which patient is at greatest risk of dying if I don't act now? Usually it's the one with a compromised airway or breathing. Don't overthink or get distracted by complex medical terms. Focus on the basics. This approach will help you answer prioritization questions quickly and accurately. Recognizing airway obstruction is key. Look for signs like inability to speak, noisy breathing, stridor, or cyanosis. On the NCLEX, these symptoms mean you must act immediately to clear the airway. Interventions might include repositioning, suctioning, or emergency procedures. Always prioritize these actions over less urgent needs. Assessing breathing involves checking the rate, depth, and effort of respirations. Listen for abnormal sounds like wheezing or crackles. Observe for use of accessory muscles or nasal flaring. On the NCLEX, if you notice abnormal breathing patterns, these findings should prompt immediate action to support ventilation and oxygenation. While circulation is important, it comes after airway and breathing. On the NCLEX, don't let abnormal blood pressure or pulse distract you from a patient who can't breathe. Once the airway and breathing are secure, then you can address circulation issues. This order is critical for safe and effective nursing care. Nursing process, assessment, diagnosis, planning, implementation, and evaluation should always start with airway and breathing. When answering NCLEX questions, assess for respiratory threats first, then plan and implement interventions accordingly. This systematic approach ensures you don't miss life-threatening problems. On the NCLEX, acute respiratory problems always take priority over chronic issues. For example, a patient with chronic COPD who is stable can wait, but a patient with sudden shortness of breath or airway swelling needs immediate attention. Always address the most urgent, life-threatening problem first. Children are especially vulnerable to respiratory problems due to their smaller airways. On the NCLEX, pediatric patients with signs of respiratory distress like retractions, nasal flaring, or grunting require immediate intervention. Always prioritize airway and breathing in children as they can deteriorate rapidly. Elderly patients are at higher risk for respiratory complications due to decreased lung function and comorbidities. On the NCLEX, watch for subtle signs of respiratory distress in older adults such as confusion or lethargy. Prioritize interventions that support their breathing and monitor closely for changes. After surgery, patients are at risk for respiratory complications like atelectasis or aspiration. On the NCLEX, prioritize interventions such as encouraging deep breathing, coughing, and early ambulation. If a patient shows signs of respiratory distress postoperatively, address these issues before focusing on pain or other concerns. Administering oxygen is a common intervention for respiratory distress. On the NCLEX, if a patient's oxygen saturation drops or they show signs of hypoxia, providing supplemental oxygen is often the correct first step. Always ensure you're following protocols and monitoring the patient's response. Proper positioning can greatly improve a patient's ability to breathe. On the NCLEX, sitting a patient upright or in high Fowler's position is often the best immediate intervention for respiratory distress. This simple action can open the airway and make breathing easier while you prepare for further interventions. If a patient has secretions blocking their airway, suctioning may be necessary. On the NCLEX, if you see signs of gurgling or inability to clear secretions, prioritize suctioning to maintain a patent airway. This intervention can be life-saving and should come before less urgent tasks. Always ensure emergency airway equipment is available and functioning. On the NCLEX, if you're responsible for a patient at risk for respiratory compromise, check that suction, oxygen, and airway adjuncts are ready. This proactive approach can prevent delays in life-saving interventions. Hypoxia or low oxygen levels can present with confusion, restlessness, or cyanosis. On the NCLEX, these signs should prompt immediate action to improve oxygenation. Don't wait for more obvious symptoms. Early recognition and intervention are key to preventing deterioration. Monitoring respiratory rate is one of the most sensitive indicators of patient deterioration. On the NCLEX, a sudden increase or decrease in respiratory rate should alert you to possible respiratory compromise. Always prioritize assessment and intervention when abnormal rates are detected. Pulse oximetry is a non-invasive way to monitor oxygen saturation. On the NCLEX, if a patient's SpO2 drops below normal, this is a sign to act quickly. Use pulse oximetry readings to guide your interventions and always address low oxygen levels promptly. Knowing when to escalate care is crucial. On the NCLEX, if a patient's airway or breathing is rapidly deteriorating, call for help immediately while initiating basic interventions. Don't delay. Timely escalation can save lives and is always the right choice when respiratory compromise is present. The NCLEX may present you with multiple issues at once. Stay focused on the most urgent problem, airway and breathing. Don't let less critical concerns like paperwork or minor complaints distract you from addressing respiratory threats first. This focus will help you answer prioritization questions correctly. Let's look at a case study. You have 4 patients, one with chest pain, one with a fever, one with shortness of breath, and one requesting pain medication. The correct prioritization is to see the patient with shortness of breath first, as this could indicate a life-threatening respiratory issue. This example shows how the ABCs guide your decisions. A child presents with a barking cough and stridor. On the NCLEX, this indicates possible croup with airway compromise. Your priority is to maintain a calm environment, provide humidified air, and prepare for possible advanced airway support. Always act quickly with pediatric respiratory distress. An elderly patient becomes suddenly confused and restless. On the NCLEX, consider hypoxia as a possible cause. Your priority is to assess their airway and breathing, provide supplemental oxygen if needed, and monitor their response. Early intervention can prevent further deterioration. Postoperative patient is drowsy and has shallow breathing. On the NCLEX, this could indicate respiratory depression from anesthesia or opioids. Your priority is to stimulate the patient, assess their airway, and provide oxygen as needed. Address respiratory compromise before managing pain or other issues. Patient with asthma is using accessory muscles and can't complete sentences. On the NCLEX, this is a sign of severe respiratory distress. Your priority is to administer a fast-acting bronchodilator and monitor their response. Don't delay, address the airway and breathing immediately. COPD patient is drowsy and has a high CO2 level. On the NCLEX, this indicates possible CO2 retention and respiratory failure. Your priority is to support ventilation, possibly with non-invasive positive pressure ventilation, and monitor closely. Always address respiratory compromise first. Patient develops sudden swelling of the lips and tongue after receiving medication. On the NCLEX, this is a sign of anaphylaxis with airway compromise. Your priority is to administer epinephrine and secure the airway. Immediate action is critical to prevent respiratory arrest. A child suddenly starts coughing and cannot speak after playing with small toys. On the NCLEX, this suggests foreign body aspiration. Your priority is to assess for complete airway obstruction and perform back blows or abdominal thrusts as appropriate. Quick action can save the child's life. A patient exposed to smoke in a fire is coughing and has soot around the mouth. On the NCLEX, suspect airway burns and prioritize securing the airway and providing oxygen. Airway swelling can develop rapidly, so early intervention is essential. A patient rescued from drowning is unresponsive and not breathing. On the NCLEX, your priority is to open the airway and begin rescue breathing. Immediate action is necessary to restore oxygenation and prevent brain injury. A patient develops hives and mild wheezing after eating peanuts. On the NCLEX, this could progress to anaphylaxis. Your priority is to monitor closely, administer antihistamines as ordered, and be prepared to escalate care if airway compromise develops. Patient with sepsis becomes tachypneic and hypoxic. On the NCLEX, respiratory distress in sepsis is a sign of possible acute respiratory failure. Your priority is to support breathing with oxygen and prepare for advanced interventions if needed. Always address respiratory compromise first. A trauma patient arrives with noisy breathing and visible chest movement asymmetry. On the NCLEX, suspect airway injury or pneumothorax. Your priority is to secure the airway and support ventilation. Rapid assessment and intervention are critical in trauma cases. Patient with a head injury becomes drowsy and has irregular breathing. On the NCLEX, this suggests possible brainstem involvement affecting respiratory drive. Your priority is to maintain airway patency and provide oxygen, monitor for further deterioration, and escalate care as needed. Patient recently extubated develops stridor and difficulty breathing. On the NCLEX, this is a sign of airway swelling. Your priority is to call for help, provide humidified oxygen, and prepare for possible reintubation. Early recognition and intervention are key. Patient with obstructive sleep apnea is found snoring loudly and has low oxygen saturation. On the NCLEX, your priority is to reposition the patient, ensure airway patency, and apply CPAP if ordered. Address airway and breathing before other concerns. Wrap up, always remember that respiratory issues are your top priority on the NCLEX. Use the ABCs airway, breathing, circulation to guide your decisions and apply common sense to every scenario. Recognize the signs of respiratory distress, act quickly, and never let less urgent issues distract you from life-saving interventions. With these principles, you'll be well prepared to tackle prioritization questions on your exam and provide safe, effective care in your nursing practice.